everyone. It's a pleasure to join you this morning to present. I'm actually I'll give a little bit more of an introduction when I come to one of my early slides about myself, but I'm the quality and assurance manager for Keltbray. And you probably sat there wondering, why is the quality manager on this call talking about psychosocial risk in the workplace and mental well-being? One, because I've got a personal interest in it, and two, and it doesn't necessarily reflect on my introductory slide, but for 17 years before I joined Keltbray, I was an external auditor with British Standards, so I know the standard. I know the ISO standards, inclusive of the 45003, but most particularly the core three standards, the 9001, 14001, and 45001 standards, which most of you will be familiar with, but certainly the ISO 45001, which is the occupational health and safety management standard. So I can talk a little bit more about the 45003 journey as we go through, and certainly the journey that Keltbray opted to take and go down, and some of the benefits that we found from that. So very briefly, that's what I'm going to cover. I haven't got a million and one slides to go through, but some of the real key stuff at Keltbray and how we do things. And as I said, the real benefits to us of following a formal structure and framework, which is basically what and fundamentally what the ISO 45003 offers. Just that, the framework for managing psychosocial risk, but people's well-being in the workplace. Yep. So yeah, brief personal introduction for me first, then where this sits within the Keltbray strategy, what route we took and what challenges we faced with it, and then we'll cover off some of the key Keltbray actions. And I'm actually sat on a site today to do an audit in Blackwall. Now, just as a brief aside, as you can probably tell from my accent, I'm not a southern lad, but I do live in the south of England. I didn't actually know Blackwall was a place. I thought it was one of these fictitious towns on London's Burning. But here I am, sat in Blackwall on a site, and I can share with you some of the stuff I've already seen on this site, and which is common to all of Keltbray sites across our business. But moving on. And it's just briefly, and it's not about me, it's about Keltbray and about, what we do as a business. But just as an introduction, that's me. I'm not going to shout from the rooftops about what I've done, what I do. But what I will do is go back to the question that you may have been asking: why is a quality manager talking to us about, psychosocial risk? Well, I am the quality assurance manager for Keltbray. I have mentioned to you that I've worked for British Standard for 17 years and know the standards, but I do have a NEBOSH General and Construction certificate. I am a trained mental health first aider. I am also trained in counselling, but most and foremost, and most importantly of all, I think I can say personally, I'm motivated to help and care for people. So that's why I'm interested, not just because there's an ISO standard covering it, but because personally, I feel quite strongly about how we care for people and how we look after people in the workplace. So there's the link, the top bullet point, the bottom bullet point, and that's the real link, really. It's because personally I care about, what we do in the workplace, and that's my personal interest in it. I'm just wondering, everybody's heard of Keltbray, certainly Mace, Kears, of the people on the call from Mace and Kears and other tier one contractors. Keltbray, very briefly, what we call ourselves as a specialist contractor. We demolish buildings, we remove asbestos, we clear sites, we remediate sites, we pile sites, we construct basements, we construct reinforced concrete frames and structural steel frames, and that's basically what we do. So I sit on a site currently where we're about to demolish a 5-storey residential block, obviously for regeneration within this part of London. And on this particular site, we are principal contractor. On other sites, and we're currently doing an awful lot of work for Mace. We're obviously contractor to Mace, who are principal contractor on those sites. So that's basically what Keltbray are all about, without taking up too much of the morning. So good to meet you all. So we'll get into the real nitty gritty of this. And in terms of positioning, as a business, we and what I would say before I actually start and get into the nitty gritty is that this isn't entirely new to Keltbray, or in terms of our philosophies and the way we do things and the way we treat people. Much of this stuff we've had long before the ISO 45003 was a twinkle in somebody's eye. Somebody in the ISO organization who writes these standards, or the body of people that writes these standards. It's been embedded within our culture, within our organization for a good number of years. So at the top of the pile, at the very top of our line of sight, if you like, is and always has been a strategic objective to look after people, to attract people to the business by what we offer and how we look after and treat people, and therefrom how we retain people and how we develop people to be the best people and that's the key bit there, and in an inclusive environment. And that's a huge phrase, and that covers an awful lot of stuff there. So therefore, we prioritise people's mental well-being, and that's something that's kind of top of the pile. We help people to remain psychologically healthy and safe at work. Yeah, and what we feel that by doing that in return, and obviously the outturn of our accounts, our annual report, etc., and what we actually do on our sites and deliver in return, we have a productive workforce, and our retention levels are pretty sound as well. So right at the very top of the tree, right at strategic corporate level, we have, as one of our key objectives every year on year, is the wish and the want and the commitment, if you like, to look after people. At operational level, and these are some biggies, and these have been with us now for a good, I would say, 10 years. PH2 and the big six. Promote health, prevent harm is one of our major operational health and safety strategies. And the big six is the two go hand in glove, talk to each other, very much overlap. The big six is the 6 areas. I've got a couple of more detailed slides to come following this, but just to set the scene, the big six are the 6 key focus areas for health and safety. Yeah, so they're what I'd call the operational health, safety and welfare strategies of Keltbray. And some of you that have worked for Keltbray will be familiar with those. But just to give you a little bit more detail there, starting with the PH2 strategy, there's a lot of information on that. So, and by the way, Jenny, I'm more than happy to provide a copy of the slides if you wish to circulate them. Yeah.
Thank you.
I'll put them in a PDF for you and get them across to you if you wish to share them. And this was one of the kind of key pieces of evidence that we presented to the external auditors when we were going through certification for ISO 45003. And as I said right at the start, it wasn't new. We didn't create this specifically for ISO 45003. This was in place, and this is what we sang to and continue to sing to. And just to direct you to the bottom comment there, specific to ISO 45003. It demonstrated our approach and kind of demonstrated to the external assessors that well-being of our people sits nicely and snugly within, and is embedded deeply into the philosophy and culture of and strategy of Keltbray. So that's PH2. I could talk all day about PH2 and what we do around that, and the campaigns that we run, and the focused inspections we do on site, and the visual standards that go alongside this, that are clear to see at any site that we. But I shan't. I'll just move on unless anybody's got any questions so far. Whilst I pause for breath. Everybody okay so far?
There's no one's put their hand up. I can see Tony or any questions, so I think
right.
Can continue for now.
Okay, we'll carry on. So we come to our big six key areas of health and safety, and again we use these as campaigns throughout the year. One of those six is health and well-being. Yeah, so at least once during the year we'll run a health and safety and well-being campaign around health and well-being. So that's the Keltbray Big Six. And again, that's something that we had in place. It wasn't new. We were able to demonstrate to the external assessor, during certification that, look, this is what we do, and this is already built within our health and safety management system and structure, as evidence. I think in terms of clauses of the standard, I'll talk a little bit more about the standard as we get there, but I think we're looking there pretty much at clause 8 of the standard, operational planning and control. Okay. So there's the two key operational health, safety and wellbeing strategies. So on to ISO 45003. And what did we have to do? Why did we actually come to the decision to pursue certification to that standard? And the standard's been with us now, and here's me trying to remember numbers and dates. It's not been with us that long. 4 years perhaps when the standard was released, and it was intended to be an extension or a continuation, if you like, of the 45,001 standard, but kind of placed emphasis upon well-being at work. Yeah, the standard is structured exactly the same way as the 45,001 standard is, as is the 914 and lots of other ISO standards. So they all now follow the same structure. But what the ISO 45003 standard does is provide a framework. And what we found was that we didn't have to do a great deal of work to our existing health and safety management system to meet the requirements of this standard. Yeah, we obviously had to enhance, embellish, make reference, if you like, to the stuff that we already did and had in place, such as our PH2, Big Six strategies, etc. Made reference to those within our policies, of course, but to actually start from scratch and produce a ISO 45003 management system wasn't necessary for us. It's simply a continuation of our 45001 management system. It will differ obviously from business to business, dependent on where you're at with your ISO journey, your broader ISO world tour, if I can put it in those terms. Yeah. So just going back to the drivers, why did Keltbray decide to pursue 45,003 certification? Well, there you go. It was to underpin our strategy. It was to demonstrate leadership and commitment to our people, to say, hey, we're serious about this stuff. You can see we're serious about it with the investment that we make. But here's further investment that we're making into additional and a further certification with British standards, and we went with British standards for certification purposes. The certification supports our policies, and it actually just goes a little bit of a way to reinforcing the actions that we've taken. Yeah, so they were really the drivers. It's safe to say that Keltbray had an established and robust ISO 45001 management system that's been certified by BSI for a good number of years. So there's that word there again I've thrown in there, continuation. It was purely and simply a continuation of that management system with a little bit extra to meet certification requirements. If you're familiar with ISO certification, with whatever certification assessment body you guys are with, you'll know the process. You'll know the process of applying, getting a quote. I can't talk to you about costs because every business will be different according to your size, and certainly that's the way BSI apportion days and costs to certification assessment. So you go through a certification assessment process. Once you pass that, the assessment body will issue you with a certificate, and then beyond then it's a case of every so often, every 6 months, every 12 months, surveillance assessment, just to make sure that everything's not folded up and put into a bottom drawer somewhere and forgotten. Yeah, that we are actually keeping up to date with what we say we do. Our last surveillance assessment was back in March. We're on an annual cycle, so March next year we'd be looking to host our next 45,003 surveillance assessment. And yes, it was straightforward, but we did meet with and faced and met up with some challenges with this. I think the biggest challenge was change. And albeit that I've said that, you know, it didn't introduce major change within Keltbray, but what it did do was kind of increase the focus on this area of health and safety management. And however major, as you guys probably know, however major that change is change, and it kind of causes well, it causes people to react in different ways. So some of the stuff we did, I'll go to the very bottom one there. We actually conducted a Robertson Cooper survey, which is in essence is a well-being survey. Takes the temperature of the company and the people that work within the company, and just sets a baseline. Where are we at with this? You know, we've put all this stuff in place prior to this, and what it actually demonstrated also to us was how effective that was, you know, and what more we needed to do. One, to enhance the stuff that we already had in place, but also to dot the I's and cross the T's for certification purposes as well. Yeah. So other challenges, as you can probably see there from the table, without going through every one of them, you know, we provided support to people. We embellished our risk assessment to include for psychosocial elements to workplace and activities. And of course we have working groups, we have committees, we have that kind of meets the requirement of the standard to consult and engage with the workforce. Yep. So fairly from a certification point of view, and any of you that are looking to go down this route, and certainly those that have 45,001 certification, this is a fairly straightforward process. And some of the stuff that we do and have done and continue to do, clearly we have policies. We have two policies specific to this. Our health, safety and wellbeing policy refers to psychosocial risk and wellbeing at work, and managing mental health and mental well-being. And we also have a separate people policy that covers these elements. We conduct risk assessment, and when we conduct those risk assessments, we consider the psychosocial elements and impact as well within those. Senior leadership is very much, you wouldn't expect me to say anything other, but our senior leadership is very much engaged. I'll just kind of flip to the next bullet point there. We have a total of 102 trained mental health first aiders. The site I'm on today actually has two mental health first aiders on this site, but within that 102 includes for our chief executive officer, who's taken the training and gone further in showing that top level commitment to this. What I was staggered with was the proportion of trained mental health first aiders to the total number of employees, and that represents a whopping 20%. 20% of our employee base is our trained mental health first aiders. Yeah. Some of the other stuff that we have a contributions app. We have a QR code on every site. I'm not so sure you can see. No, I was in the canteen when I was inducted this morning. But the contributions box is in there. You can either fill out a card, put it in the box, scan the QR code, make contributions to that. But we actually call it contributions, and we collect all that information, and we put in place actions to address those. And then of course we have an employee assistance program. I think that's pretty standard, hopefully standard practice within the industry these days. And there's just some of the organisations down the bottom there that we actually support. Just a little bit about the site I'm on. I was pleased to see that when I was inducted first thing this morning that mental health and mental well-being was covered within the induction. There was certainly what was also covered is what I can do, what access I have to people to speak to should I need to speak to somebody on site. And that's not just me, but anybody else that works on this site as well. I think we've got about 70 people on this site currently. So that was really good for me to hear. Yeah. And I think hopefully I've covered as much about the ISO 45003 standard as I need to cover. What I've also covered there is how we as an organisation saw it as important, and how we as an organisation have made significant investment, not just in upkeeping and training people, but in actual certification itself. I mean, it's not cheap. Any certification body and certification that goes with it isn't cheap. From the initial certification assessment through surveillance, it's quite significant additional cost, but that will vary according to the size of your own organizations. Yeah, if you're considering going down that route yourselves. I think that's about